A quick insight from WellView 365, powered by freshnews.ai. Operational efficiency for healthcare staff now hinges on tightening internal handoffs instead of just adding more tools or meetings. Executive summary: cleaner internal communication loops for patient-facing content standardized how change requests are captured, routed, and approved across channels. Structured intake, predefined approver paths, and single-source templates reduce ambiguity and rework in content updates. The result is more reliable, consistent patient messaging that supports operational efficiency for healthcare staff. Today's signal: operations leaders are revisiting communication loops because quarterly planning is exposing the gap between limited staff capacity and rising demand for real-time patient messaging changes. Unstructured requests that bounce between coordinators, clinicians, and compliance add delay and consume scarce hours. Tightening how requests enter, get triaged, and leave the workflow is becoming a near-term staffing control. WellView 365 enables streamlined internal staff communication by centralizing control management, control orchestration, and control delivery across end-to-end delivery paths. Why it matters? Here are 4 takeaways. First, reduces the number of back-and-forth messages needed to clarify what should change on patient-facing channels. Second, shortens the time from policy or scheduling decisions to visible updates in patient communications. Third, lowers the risk that different clinics or units show conflicting information to patients. Fourth, makes it easier to plan staffing because content work is captured in a defined, repeatable flow. How it works in practice: a common example is a change to clinic hours or masking rules that must be reflected on waiting room screens and signage, SMS reminders, and portal banners. A unit manager emails or messages a generic inbox. A coordinator pastes the request into a ticket or spreadsheet, and a content specialist rewrites it for templates before sending it to clinical and compliance approvers. Delays show up when details are missing, owners aren't clear, or approvers receive inconsistent versions. When teams standardize the intake form, predefined approver groups, and link each patient-facing channel to a single source template, updates move in one pass instead of several loops. One practical adjustment: add a single entry request form for patient-facing content changes and route many new requests through it starting this week. What to do next? Here are 4 takeaways. First, audit the last month of patient-facing content changes and list every step, owner, and tool involved. Second, define one standard intake template for content changes and remove alternative request paths. Third, map default approver groups for common message types and document expected response times. Fourth, review configure your content tools or ticketing system to link each approved message to specific patient-facing channels and publishing schedules. Read more at wellview365.com.